Esther, thank you. Let's talk now about trying to fight cancer, specifically childhood cancer. Research is a key to trying to fight that battle. And the St. Baldrick's Foundation is a huge private funder of childhood cancer research grants. In fact, the organization just awarded 90 of them, totaling $23.5 million. Now, that is spread out all across the country, but some of the money is staying right here in Connecticut, specifically going to 2 hospitals. This morning, I'm saying good morning to a doctor from each of those hospitals. I have to my immediate left, Dr. Andrea Orsi from the Connecticut Children's Medical Center, and Dr. Juan Vasquez here from Yale. Welcome to both of you. Congratulations. Good to have you on.
Thank you. Thank you very much. Thank you.
And now this is just in general a question for both of you to answer. Just talk about what it means to get this grant money and what you guys are going to be able to do. Or before you get into specifics, just how happy you are for what St. Baldrick's is doing.
Well, St. Baldrick's is one of the largest founders worldwide for childhood cancer research grants, and they really focus on researching cures that's unique for children, and it's just such a privilege and honor to be able to work with them.
And Doctor, I imagine you feel the same way.
I absolutely feel the same, and one thing is that people don't realize is that only about 4% of cancer funding nationally goes to pediatric cancer specifically. And we know that kids are not just little adults. They have different types of cancers that behave differently, so it's so important to have research dedicated to their diseases.
I don't even think I knew that.
Yeah.
4%, it seems like we need to get that a little bit higher. So, okay, instead of me trying to learn myself as I've done, just summarize, how much money did you get? What are you putting it towards, Doctor?
So we received a supportive care grant, and it's $50,000. At Connecticut Children's, we have a team of oncologists, cardiologists, and endocrinologists, and together we have developed a clinical practice guideline, and we are validating our scoring system of our guideline with the hopes that we'll be able to prevent and diagnose and treat early cardiovascular disease to improve the quality of life for childhood cancer survivors.
Now, is this with a specific treatment that just trying to mitigate side effects, I guess?
So about half of all cancer treatment involves a chemotherapy group called anthracyclines, but they're not the only type of agent that can affect heart. But the heart toxicities of the chemotherapy can severely limit our patients' abilities to receive chemotherapy as well as their quality of life. So we're trying to prevent cardiotoxicity so that they can have a long, beautiful quality of life they deserve.
Wonderful. Doctor, you're focusing on certain types of brain cancer, yes?
Correct. So at this point, actually, pediatric brain tumors are the leading cause of childhood cancer deaths. So we really need new treatments. And what we focus on is trying to harness the immune system to find ways to use it to treat these pediatric brain tumors.
Yeah, but I imagine the hard part is getting the immune system to focus just on the cancer cells and not destroy everything else around it.
Absolutely right. And so what we focus on is a specific type of protein called SOX2 that we found is expressed mainly only on the tumor cells and not the rest of the normal body cells. And so we're trying to develop a kind of treatment vaccine that stimulates the immune system to target those brain tumor cells.
Fantastic. And is this your first grant through St. Baldrick's, or is it the same grant that has been extended now?
It's the same grant that's been extended. I've received it for the past 2 years, and I was fortunate enough to have it renewed for a 3rd year.
Okay. How much, well, actually, unfortunately, we're sort of out of time. I would love to talk to both of you for probably about 10 minutes, but yeah, the common link here is that chemotherapy, fighting cancer, how effective it is against cancer cells is one thing, but trying to mitigate the effects on the body too, so that different therapies don't wind up hurting you as much as it's helping you. That's a big focus on this too, and that's what both Dr. Orsi and Dr. Vasquez are working on. I know that's very, very simplified, but thank you both. It's great what St. Baldrick's is doing, and it's great what both of you are doing. A pleasure to meet you both.
Thank you very much.
Thank you so much. All right, well, coming up on the Fox 61 Morning News, we're talking about new adventures and badges ahead for Girl Scouts across the state as more girls are enrolling. We have details on what is new for that organization.